It's like we're drowning in information these days.
Right.
Everywhere you turn, there's something new, something else to absorb. And it's so hard to filter it all. Trying to figure out what's actually true, what's just noise, it can feel completely overwhelming. It's exhausting.
Absolutely. It's a constant struggle. And to make things even trickier, there are so many voices out there trying to exploit that feeling of overwhelm, especially when they're trying to persuade us to buy into something, whether it's a product or an ideology.
Right, like they're preying on that need for certainty, which, by the way, is a brilliant point that Timothy Caulfield makes in his book, The Certainty Illusion. He really dives into how this desire for simple, clear-cut answers can be manipulated, particularly in the face of all this overwhelming information.
And it's not just about feeling overwhelmed, it's also about wanting to do good. We want to believe we're making the right choices, especially when it comes to things like our health, the environment, or supporting causes we believe in.
Exactly. So today we're tackling this whole certainty illusion head on. We're going to unpack it, explore how it shows up in different areas of our lives, and hopefully give you some tools to navigate this incredibly complex information landscape.
And we've got a really fascinating mix of sources to draw from for this deep dive. We'll be looking at Caulfield's book, The Certainty Illusion, of course, and we've got some key points from an interview with him. But we're also going to broaden the scope and explore how this idea plays out in discussions around environmental assessment reform, the ongoing misinformation surrounding the toxic drug crisis, and even the perceptions surrounding what some call the masculinity crisis.
It's a lot to cover, but that's kind of the point, right? We're trying to cut through the noise and give you the essential takeaways from all these different sources, the aha moments that might help you make sense of it all.
And ultimately, what we're aiming to do is help you become a more critical and discerning consumer of information. Someone who can recognize these tactics, spot the red flags, and make more informed decisions in all aspects of their life.
Okay, so let's start with this concept Caulfield calls the goodness illusion. What exactly is he getting at there?
Well, Caulfield basically argues that this goodness illusion is a tactic, a way of framing a message to make you feel like you're choosing the inherently good option, even if the evidence might not be that solid.
So it's like appealing to your moral compass, making you feel good about siding with them, whether it's choosing a product that claims to be natural or supporting a cause that seems undeniably virtuous.
Right. It taps into that part of us that wants to do the right thing, to be a good person. And the thing is, this goodness illusion often comes packaged with the promise of certainty. It's presented as a clear, simple path, supposedly backed by evidence, that cuts through all the confusion and leads you directly to the good outcome.
So the more virtuous it feels to agree with the message, the more skeptical we should be.
It's definitely a sign to pause and examine things more closely. If it feels too easy, too good to be true, it probably is. Another key point Caulfield brings up, and this is crucial, is the role of our emotions. He says those strong emotional responses, particularly anger or fear, can actually be a warning sign.
It's like your gut feeling is telling you something's off.
Exactly. And this connects directly to the whole issue of misinformation. It's not a coincidence that the content that tends to spread most rapidly, especially online, is often the stuff that triggers those visceral emotional reactions. It's like emotional wildfire.
Like emotional pollution, as some researchers call it. And it makes sense when you think about it. If something makes you really angry or really scared, you're more likely to share it with others.
And it's not just a hunch either. Studies have shown that over the past 20 years or so, there's been a significant increase in the number of negative headlines we see in the media, and those headlines tend to get shared more widely. So when you encounter something that triggers a powerful emotional response, especially a negative one, take a breath, hit the pause button, and try to evaluate it critically before you hit the share button.
Okay, so if something makes you feel like your side has definitively won or lost, or if it provokes a really strong emotional reaction, those are major red flags that maybe, just maybe, you're being manipulated.
Precisely. That feeling of absolute certainty, that us versus them mentality, can be a strong indication that the information you're consuming is designed to provoke an emotional response rather than promote genuine understanding.
Okay, let's shift gears a bit and look at a really important but also incredibly sad example of how misinformation and this us versus them thinking can have real world consequences. We're talking about the toxic drug crisis, right? Science World recently hosted an event specifically to address the misinformation surrounding this crisis in British Columbia, and it's a perfect example of how these illusions can turn deadly.
The event was all about breaking down those harmful misconceptions and fostering a more informed and compassionate conversation about this issue, which is so critical right now.
And they were very intentional about acknowledging that they were on the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations, which sets the tone for respectful and inclusive discussion.
Right from the start, they highlighted how misinformation about the toxic drug crisis often reinforces harmful stereotypes and contributes to an us versus them mentality. And this isn't just an abstract philosophical problem, it has real world consequences for people's lives.
It's literally life or death for some people. One of the panelists, Dr. N. Wyman, made a really poignant point about how people who have lost their lives to this crisis are sometimes viewed as disposable, as throwaway people. It's a stark reminder of the dehumanizing effect of stigma and misinformation.
And she contrasted that with the reality of those affected, emphasizing their inherent humanity. It's so important to remember that these are real people with families, loved ones, and stories.
It was really inspiring to hear about initiatives like the Nook Home Society, which was founded by a student at Simon Fraser University. They're doing incredible work providing science-backed harm reduction education to young people, trying to break down stigma and equip them with accurate information.
One of their initial findings really highlights just how widespread the misinformation is. Over 50% of the young people they surveyed didn't even realize that the drug supply is contaminated.
It's scary to think how many people are making decisions without having all the facts. And even these efforts to educate and provide harm reduction strategies face pushback. There are those who argue falsely that it encourages drug use.
It's incredibly frustrating because the evidence shows just how crucial harm reduction is in saving lives.
The event also featured some really moving personal stories, including a parent who spoke about their regret for not understanding addiction better and for believing in the tough love approach, the idea that letting someone hit rock bottom might somehow force them to change.
The problem is that approach is often counterproductive. Removing support and love can actually make things worse for someone struggling with addiction, and unfortunately, scare tactics generally don't work either.
The statistics paint a really bleak picture, too. First Nations people are disproportionately represented in toxic drug supply deaths across all 5 health regions in British Columbia.
It's a tragic reflection of the systemic inequalities that continue to exist. The message from the event was clear. We need to treat everyone affected by this crisis with compassion, respect, and a recognition of their inherent worth as human beings, especially those who have already been marginalized and traumatized, like the kids that did come home from residential schools.
It's heartbreaking. And the situation is so dire that some doctors have even opened unsanctioned supervised consumption sites, acts of what they call nonviolent civil disobedience.
It really highlights the urgency of the situation and the feeling that the existing systems aren't adequately addressing this crisis, and the projections are really alarming. If the death rate stays the same, we could be looking at another 7,500 deaths in BC in the next 3 years.
We have to do better.
Absolutely. And on a slightly different note, but still relevant to this conversation, there was a really interesting perspective shared about parental concerns around substance use. It was acknowledged that while cannabis is often a worry, it wasn't seen as the primary concern or a gateway drug in this particular case. Instead, ADHD was identified as a contributing factor to the use of harder drugs.
It's a reminder that the reality of addiction is often far more complex than the simple narratives we sometimes hear.
Absolutely. Now, circling back to Caulfield's certainty illusion, let's focus on how this plays out in the realm of science and health. It might be surprising to hear that even scientific research itself isn't immune to these problems.
Caulfield talks about how the research environment is often clouded with bad evidence, unreliable studies, and even predatory journals. So even experts have to be really careful about what they're reading and citing.
And he brings up this really important concept called science exploitation, which is when people use the language of science, all the technical terms and jargon, to essentially promote ideas that aren't actually supported by solid evidence. It's like dressing up a flimsy argument in a lab coat.
So just because something sounds scientific doesn't mean it actually is.
Right. We need to be critical thinkers, look beyond the surface, and evaluate the sources and the claims being made. And this is where something that might seem a bit counterintuitive in today's world actually becomes really important. Humility.
Humility, like admitting that you don't know everything.
Exactly. And the research actually shows that people who approach information with a sense of humility are less susceptible to misinformation. They're more willing to consider different perspectives and less likely to jump to conclusions.
It makes sense when you think about it. If you're open to the possibility of being wrong, you're probably going to scrutinize information more carefully.
Precisely. And this brings us to a really important report by the Council of Canadian Academies on the socio-economic impacts of science and health misinformation. It's a pretty comprehensive look at the problem.
Yeah, and even the report itself acknowledges that its findings will be subject to scrutiny, which is a healthy part of the scientific process.
Of course. But their conclusions are pretty sobering. They found that misinformation can have really damaging effects on our personal well being, our communities, and society as a whole. This can lead to preventable illnesses and deaths, economic losses, increased polarization, and a decline in public trust.
It's kind of terrifying to think about how these false narratives can really have tangible consequences in the real world.
Absolutely. And we can't ignore the economic factors that are driving the spread of misinformation, especially online. Social media platforms often make money based on how much time people spend on their sites, how many clicks and shares they generate. This unfortunately creates a perverse incentive to prioritize attention-grabbing content, even if it's not true.
So, the more outrageous and emotionally charged something is, the more likely it is to go viral, regardless of its accuracy.
Exactly. It's all about the clicks and the shares. And that leads to the proliferation of clickbait headlines and outright fake news designed to spread quickly and generate ad revenue.
It's like a race to the bottom of the information barrel.
It can feel that way sometimes, and we see similar things happening in the wellness industry. So-called wellness influencers often build a following based on their appearance and lifestyle, but then they use that trust to promote products and services that might lack any real scientific backing.
It's another example of that science exploitation Caulfield was talking about.
Exactly. They're using the language of science to sell things that might not actually be beneficial or could even be harmful. And then you've got the social media algorithms themselves, which can inadvertently amplify the problem.
How so?
Well, these algorithms are designed to keep you engaged, right? And studies have shown that content that provokes strong emotional reactions, especially outrage and negativity towards other groups, tends to generate more engagement.
So the algorithms are essentially rewarding the spread of outrage and polarization.
In a way, yes. They're not necessarily intentionally promoting misinformation, but they're prioritizing content that gets people riled up and that can unintentionally contribute to the spread of harmful narratives. We saw this very clearly with the Freedom Convoy in Canada, where misinformation played a significant role in fueling those divisions.
It's like social media is training us to be more outraged and less tolerant of differing opinions.
It's a real concern. And then you add in our own cognitive biases, our natural tendency to seek out information that confirms our existing beliefs, which psychologists call confirmation bias. And it becomes even more challenging to break free from these echo chambers.
It's like we're all living in our own little information bubbles, selectively filtering out anything that challenges our worldview.
It can feel that way sometimes. And this leads to a real disconnect between what the scientific evidence actually says and what the public believes.
Like with the debate about genetically modified foods, the scientific consensus is that they're safe, but a large portion of the public still believes that scientists are divided on the issue.
It's a classic example of how effective misinformation can be at creating doubt and uncertainty, even in the face of overwhelming evidence. And this isn't a new phenomenon either. We've seen this throughout history with various health-related conspiracy theories.
Like the idea that HIV was created as a bioweapon.
Exactly. These kinds of theories often emerge during times of fear and uncertainty when people are looking for simple explanations and someone to blame. And they can be incredibly difficult to debunk, even with clear evidence to the contrary.
We also see this with climate change skepticism. There are groups out there, like Friends of Science, that actively challenge the overwhelming scientific consensus on climate change. And there's a documented correlation between certain political ideologies and skepticism towards climate science.
It seems like trust in science and health institutions would be crucial in navigating all of this.
It definitely feels that way. If you can't trust the experts, who can you trust?
And generally, trust in scientists in Canada is pretty high, but it does fluctuate depending on the specific topic. For example, trust in scientists did dip a bit during the COVID-19 pandemic. And there's also this concern that industry funding can potentially influence how people perceive the trustworthiness of scientists.
It makes sense that people might be more skeptical of research that's funded by a company that stands to profit from the results.
It's a valid concern. And we also have to acknowledge that socioeconomic factors can play a role in trust levels. Research suggests that people with lower incomes tend to have lower levels of trust in institutions, and they might also experience a greater erosion of trust during times of crisis compared to those with more resources.
It's like a vicious cycle. The people who are already the most vulnerable are also the most likely to distrust the very institutions that are supposed to be helping them.
It's a serious problem. And then you add in political polarization, and it becomes even more challenging to find common ground and develop effective solutions.
When people are entrenched in their political ideologies, it becomes really difficult to have a nuanced conversation about complex issues.
Absolutely. And this polarization can make it really hard for governments to enact policies that serve the broader public good. Sometimes those policies end up catering to a very specific segment of the population rather than considering the needs of everyone. Okay, let's talk about the real world harms of health misinformation. This is where it gets really serious.
It's one thing to debate abstract ideas, but when people are making life or death decisions based on false information, that's a whole different level of concern.
Exactly. And there's plenty of evidence to show that health misinformation has very real consequences. For example, studies have found that cancer patients who opt for alternative medicine instead of evidence based treatments have a much higher risk of dying.
It's tragic, especially when those alternative treatments are often promoted as miracle cures with no scientific basis.
And then you have all the unsubstantiated claims about vitamins and supplements. People are taking mega doses of these things based on misinformation, and it's leading to serious health problems and even trips to the emergency room.
It's wild how easy it is for people to get swept up in these fads and trends, especially when they're presented in a way that sounds scientific but lacks any real evidence.
And of course, we can't talk about health misinformation without talking about vaccines. The link between misinformation and vaccine hesitancy is undeniable.
It's so frustrating. We have these incredibly effective tools to prevent serious diseases, and yet misinformation is eroding public trust in them.
And even small drops in vaccination rates can have a big impact. It disrupts what's called herd immunity, which is when enough people are vaccinated to protect those who can't be vaccinated for medical reasons.
So those who choose not to vaccinate aren't just putting themselves at risk, they're potentially putting others at risk as well.
Exactly. And the consequences of these outbreaks are significant. There are healthcare costs, lost productivity, and in some cases, even death. Economic modeling done during the COVID-19 pandemic estimated the huge financial impact of vaccine hesitancy in Canada.
It's crazy to think about how much we're spending to deal with preventable diseases because of misinformation. It's like we're shooting ourselves in the foot.
It really is. And we also have to consider the impact of misinformation on the scientists themselves. All the public criticism, the accusations, and the attacks can be incredibly discouraging.
It's like they're being punished for doing their jobs and trying to share accurate information.
It can feel that way. Controversies like ClimateGate, even though the scientists involved were ultimately cleared of any wrongdoing, can have a chilling effect on research. Scientists might be hesitant to tackle certain topics for fear of being attacked or misrepresented, and this can ultimately hinder scientific progress and our ability to address important issues like climate change.
It's like we're creating a climate of fear that's stifling innovation and the free exchange of ideas.
It's a real concern, and we see similar things happening with efforts to address global health challenges. For example, there's been a lot of opposition to golden rice, a genetically modified crop that was specifically designed to combat vitamin A deficiency in developing countries.
It seems like a no-brainer. Why wouldn't we want to support a solution that could potentially save millions of lives?
You'd think so, but a lot of the opposition is based on misinformation and unfounded fears about genetically modified organisms. And this misinformation is preventing this potentially life-saving innovation from reaching the people who need it most.
It's a prime example of how good intentions can be derailed by fear and misinformation.
The COVID-19 pandemic really underscored the wide-ranging impacts of misinformation on a global scale.
It felt like we were all bombarded with conflicting information, and it was hard to know who to believe.
It was a really challenging time, and the spread of misinformation about the virus, the vaccines, and the public health measures contributed to lower vaccination rates, which in turn led to increased strain on healthcare systems and potentially created more opportunities for new variants to emerge.
It's like we were fighting a war on two fronts: the virus itself and the misinformation that was undermining our efforts to contain it.
And there's also growing evidence suggesting a link between exposure to misinformation and both the severity and duration of long COVID.
So the misinformation isn't just affecting people in the short term, it's potentially having long-term health consequences as well. It's terrifying.
It really is. It's also interesting to note that some research suggests that certain personality traits might make individuals more susceptible to believing and sharing misinformation.
Like what?
Well, some studies have found that people who tend to be less agreeable, more extroverted, or who have a higher tolerance for risk might be more likely to buy into and spread false information.
It makes sense that people who are less concerned about social harmony or who enjoy taking risks might be more drawn to sensationalized or controversial content.
It's definitely something to consider. Okay, so with all of this in mind, what can we actually do to combat misinformation and this erosion of certainty?
It feels like such a massive problem. Where do we even begin?
It's a multifaceted problem, so it requires a multifaceted approach. There's no single magic bullet. But there are things we can do. For example, we can improve how we identify and flag misinformation. Using clear labels like false and explaining why certain claims are misleading can be helpful.
So, not just calling something out as false, but actually explaining why it's false.
Exactly. And this approach, called inoculation, where you expose people to weakened forms of misinformation to help them build resistance, is also showing a lot of promise. It's like giving someone a small dose of a virus to help them develop immunity.
It's an interesting analogy. But just labeling something as false might not be enough to change someone's mind, right?
You're right. That's why it's so important to provide accurate and easily digestible refuting information. And the way that information is framed really matters. It needs to be tailored to the specific audience and their values.
So it's not just about stating the facts, it's about communicating them in a way that resonates with people.
And you might be surprised to learn that even brief factual corrections can be effective. You don't always need a long, drawn-out debate. Sometimes a short, clear explanation can go a long way.
That's good to know. I've also heard about the idea of aligning messages with people's moral values. How does that work in practice?
So instead of directly challenging someone's deeply held beliefs, you try to find common ground by framing the information in a way that aligns with their values. For example, if you're trying to talk to someone who's skeptical about climate change, instead of focusing on the scientific evidence, you might emphasize the economic benefits of investing in green energy, like creating new jobs in their community.
It's about appealing to their self-interest while also promoting a positive outcome.
Exactly. And this can sometimes be more effective than just bombarding them with facts and figures that they might already be predisposed to reject.
What about using storytelling or personal narratives as a way to correct misinformation?
Storytelling can be really powerful because it allows people to connect with the information on an emotional level. But it's important to use it carefully. We don't want to elevate anecdotal evidence above scientific data. The goal is to use stories to illustrate and personalize the facts, not to replace them.
It seems like we need a comprehensive approach that addresses this problem from multiple angles.
Absolutely. We need to target the sources of misinformation, work to reduce people's susceptibility to it, and build a more resilient society that's less vulnerable to these kinds of manipulative tactics.
And what about the role of institutions? What can they do?
Institutions have a really important role to play in combating misinformation. They need to be transparent, accountable, and act in the public interest. And they need to have the resources to effectively address this problem.
It seems like social media companies in particular have a huge responsibility here.
They do, and we are seeing some positive steps. Some platforms are partnering with independent fact checkers to identify and flag misinformation, and there are initiatives like Science Up First that are actively working to promote accurate science-based information.
It's encouraging to see these efforts, but it feels like we're playing catch up.
It can feel that way, and journalists also have a crucial role to play. They need to be diligent about verifying information, using diverse sources, and presenting the information in a way that's both accurate and engaging.
The way information is framed can really influence how people understand it.
Absolutely. For example, framing the climate change debate in terms of potential economic losses versus potential economic gains can elicit very different responses from the public. It's all about finding the right angle to resonate with people's values and concerns.
And at an individual level, what can we do to protect ourselves from misinformation?
It all starts with critical thinking. We need to be more aware of our own biases, evaluate sources carefully, and be willing to question what we see and hear, even if it confirms our existing beliefs.
It's so easy to get caught up in the emotional rush of a compelling narrative, especially when it aligns with what we already believe.
It is. And that's why media literacy is so important. We need to understand how different media sources operate, what their biases might be, and how to distinguish between credible and unreliable information.
It feels like these skills should be taught in schools.
They absolutely should be. And there are some fun and engaging resources out there, like the game Bad News, that can help people learn about misinformation and develop those critical thinking skills.
That's like a vaccine for your mind.
I like that analogy. And then, of course, we have to talk about trust. Rebuilding trust in our institutions is essential.
But how do we do that when there's so much distrust and skepticism out there?
It's a big challenge. Public health officials and medical professionals need to be proactive about addressing historical inequities and engaging with communities in a way that's respectful and culturally sensitive.
Like meeting people where they are rather than expecting them to come to us.
Exactly. And we've seen some really successful examples of this, like the culturally specific outreach programs in Indigenous communities and the partnerships with Black-led healthcare organizations.
Those initiatives have been really effective at building trust and delivering positive health outcomes.
It's about recognizing that one size doesn't fit all. Different communities have different needs and concerns, and it's important to tailor our approach accordingly. And on a broader level, we need transparent, effective, and equitable governance across all institutions to rebuild and maintain public trust.
It seems like the two-eyed seeing approach, which combines indigenous knowledge and Western science, offers a promising framework for building trust in healthcare.
Absolutely. It's about recognizing the value of different ways of knowing and finding ways to integrate them in a way that's respectful and beneficial for everyone. And we've seen this in action with the Nisitchewayasik Cree Nation's response to the COVID-19 pandemic. Their community outreach program, which incorporated both Indigenous knowledge and Western medical practices, was incredibly successful.
It's a great example of how we can bridge those divides and create more holistic and effective solutions.
It's also interesting to note that in Canada, there aren't really specific laws that prohibit the spread of misinformation.
Why not? It seems like that would be a pretty straightforward way to address the problem.
It's more complicated than it might seem. Creating such broad laws would be legally challenging, and there are concerns about freedom of expression and the potential for censorship. While some existing laws around defamation and consumer protection might apply in certain cases, their effectiveness in combating widespread misinformation is limited.
So it's more about addressing the root causes of misinformation rather than just trying to regulate it after the fact.
Exactly. It's a complex problem that requires a multi-pronged approach. We need to tackle the sources, reduce susceptibility, and build resilience. And we need to recognize that this is a long-term challenge that will require ongoing effort and vigilance. We can't afford to turn away from it.
It's a bit daunting, but it's also empowering to know that there are things we can do, both individually and collectively, to fight back against misinformation and this manipulation of our desire for certainty.
Absolutely. The more aware we are of these tactics, the better equipped we are to resist them. And the more we prioritize critical thinking and media literacy, the more resilient we become as individuals and as a society.
So to recap, the key takeaway here is that the feeling of certainty can be a powerful tool, but it can also be a dangerous illusion. We need to be wary of those who try to exploit our desire for simple answers and our innate goodness. It's crucial to be mindful of our emotional reactions, critically evaluate the information we encounter, and be wary of those who try to divide us with an us versus them mentality.
And as we wrap up, I want to leave you with a question to ponder. In a world increasingly shaped by algorithms designed to maximize engagement, how can we cultivate information environments that prioritize truth and understanding over certainty and outrage?
It's a really important question, and if you're interested in delving deeper into this topic, I highly recommend checking out Timothy Caulfield's book, The Certainty Illusion, and the Council of Canadian Academies report on the socioeconomic impacts of science and health misinformation. Both are really valuable resources. Thanks for joining us for this deep dive.